saying? Oh my God, just say we are live. I don't know. Okay, hello everyone. We are live. I didn't really plan to come online. I just said I should give it a try. I believe you can hear me. If you can hear me, just say hi. I'm just in my room, my baby. So I just said let me give it a try. So if you can hear me, just say hi. I can hear you. So that you can drop any question and I will answer. So it's just like an unplanned live quest or an unplanned live video. So my face is not going to show, and you might hear my baby's voice at the background because we are just in the room and she refused to sleep. Then I said I should say hi to those online. That's good. Oh my God, I can see a lot of people online. Hi Matty, hi Susan Gochuku, hi Tabiso. Sorry if I can't pronounce it well, but I'm saying hi. Hi Steven. Just see everybody saying hi. Hi Versatile Nurse Frances, Success Monday, Ikechi Cynthia, Mashud Jimon. Hi. Ranin, I'm seeing you. I'm good, Matt. Joy Isaac. Hi. This is an unplanned live. I just said let me just click on the live button. So I came online. They said they can hear us, Josie. Bola, hi. Jem, hi, Nurse Mercy Mary. I am fine, Jem. Nice seeing you all online. I never planned this live. Like, seriously, I'm going to be sincere. I just said I should click on the button live. So if you have any question on this live video, just drop. You're going to hear my voice to explain it. So I'm here to take your questions. If you have any question and you want Nurse Miss Mary to answer, it's an unplanned live. But since I'm online, I'm going to give answers to your questions. So just drop your question in the comment section if you have any for me. I'm waiting. If there's any question, just to say we're waiting. Say I'm waiting. Yes. Also, I can't see the top chat. Please, you can drop a message again if you have. Okay, let's see. Okay. Ugoma says hi. I think I've answered. Ogochi says hi. I'm good. Ikechi, I can see that. Success Monday. Yeah, Mercy, my namesake, I can see you. Click thumbs up on the video. Okay, what are the symptoms of fallopian tube blockage, ma? I think one of the symptoms you should notice from fallopian tube blockage is actually pain. Yes, you could get pain from fallopian tube blockage. That's one of the obvious symptoms because there's a blockage and movement is being restricted. I think Josie is taking that question. I'm not even switching words. And I'm trying to get our first question. Okay, what are the signs, symptoms of fallopian tube blockage? Like I earlier said, pain is one of the major cause of fallopian tube blockage. There could be general pelvic pain. There could be pain during sexual intercourse. There could be foul smelling from the vagina. Depends. This person could be having nausea and vomiting. So if as a lady you continuously experience severe pain, like real pain during sexual intercourse, pain around your pelvic region, that can be a sign of fallopian tube blockage. Sorry if you can hear my baby's voice in the background. Please and please don't be offended. Like I earlier said, I didn't plan this live. So Jem, I hope I've answered your question. Then Bola said, what causes pain during sex? There could be a lot of reasons why there is pain during sex. I think I made a full video explaining the cause of pain during sex. All you have to do is to type causes of pain during sex by nurses lecture room and the full video will pop out. Endometriosis can cause pain during sex. Infection can cause pain during sexual intercourse. It all depends on the type of pain. For those that have watched my video on the cause of pain during sex, I explained the various types of pain. Yeah, so if you understand the various type of pain, that will give you a clue on what is actually causing the particular type of pain. So Jem, I would advise you check our YouTube video. We have a full video that explains the various causes of pain during sex. So that's for Jem. Then I want to say, quick question: what happens when you don't have sex for 2 years? Nothing happens. You still be okay. You still be fine. It doesn't really affect your reproductive organ when you don't have sex, even for 3 years. So it's not something you should be worried about. I don't want to miss any question. Josie. Okay, please, please, what is the solution for yeast infection? Yeast infection. Josie, are you joining me to talk? In terms of yeast infection. Oh, sorry. It's okay. It's okay. Good girl. This is a live video that's not planned, so that's why you can make. I think we should do a better live video where we'll not have Josie disturbing us. Josie will be far away, but I'll try as much as possible to create that live video soon. But I'll just answer as much as I can. Okay, please, what's the solution to yeast infection? Yeast infection, most people use this to make it easy, use anti-yeast medication, antifungal medications. They can help out. Then boric acid, there's what we call boric acid. Boric acid can also help with yeast infection. You can read more on the internet about boric acid if you know. So boric acid has helped a lot of people when it comes to yeast infection. You can check more on boric acid. Maybe I'll make a video on that to explain. This is just a quick. I'm a student nurse, but my sister just got uterine fibroids. So what should we do? Okay, in terms of fibroid, the type of fibroid determine what results you will use for that particular type of fibroid. You get, depending on the size, how big it is, the location. Sometimes most fibroids don't need treatment. They go on their own. When a woman is in her menopause, those fibroids go on their own. But if she's not in her menopause, she's having pain, she's having a lot of things, she might need to see a doctor. And if care is not taken, a surgery might be involved to actually remove the fibroid if she is planning to give birth, and if she's if she's planning to give birth. Just I'll beat you. So like I last said, don't mind the noise at the background, please and please. Josie is disturbing me and I didn't plan this live video. I'll do a more standard live video where you can drop your questions. Then what am I saying? I might just give you a clue on how to get the videos on what you're looking for. My wife had ectopic. Am I missing something? Sorry. Okay, I've talked about the fibroid already. Jem, I said nurses lecture room. We made a video on pain, causes of pain during sex. So just check our YouTube channel or type pain during sex by nurses lecture room. You will get a full video. Just watch it. Sis will answer your question. Trust me. The other one says, my wife had an ectopic pregnancy 2 years ago. What are the chances of having it again and in future? In terms of ectopic pregnancy, your wife has a chance of getting it again, but that doesn't mean that for every pregnancy she's going to get an ectopic. Because those that have history of ectopic pregnancy, they have higher chances of getting it again. But I've seen people after their first ectopic pregnancy, they don't have another ectopic again. They just give birth normally. They only experience ectopic once. But having a history of ectopic pregnancy make her like at a higher risk of having another ectopic pregnancy. But having it doesn't mean doesn't have a stamp like, oh, you continuously have ectopic pregnancy every time. So I think that's to vary. So what I advise in regards to that ectopic pregnancy is for her to try as much as possible to treat every PID. If there's a pelvic inflammatory disease, she should treat it. And also during that last ectopic pregnancy, was the fallopian tube removed or was it still intact? If she has any infection, she should treat it as soon as possible. And also Tavari, right? And also Tabari, whenever she notices she's pregnant, anything, immediately she just notices she's pregnant, she should try as much as possible to go for scan as soon as possible. There's what we call transvaginal scan. So that transvaginal scan will help her to know, okay, this is the problem, this is the problem, this is what I need to do or not. I don't know if I answered a very question. Can infertility in women be inherited? Infertility in women, can it be inherited? It can, depending on there's some medical history that can make a woman prone to infertility. So I can't say infertility can be inherited directly, but if some medical conditions are inherited from parents or from their family or relations, that can increase her chances of infertility. But the word infertility might not be inherited, but the medical condition around infertility might be inherited. Is it possible to have pain on the side after COVID-19 vaccine? On what side? You might have pain on the particular location where the COVID-19 vaccine is given. So that is normal for you to feel pain at that particular location. That's the hand where COVID-19 vaccine is given. What causes white teeth? As Messi said, please, what causes no ovulation? What causes no ovulation? Polycystic ovary syndrome can cause no ovulation, like cause alternate ovulation. Like this person will have ovulation to this month, the person will not release egg the next month. So polycystic ovary syndrome can affect a woman's ovulation cycle. Old age, as a woman advances, as a woman increases in age, that can affect her ovulation cycle. What causes white things from the woman's vagina? Depend on the white things. Some are yeast infections, some are fungal infections, especially white things that look like cottage cheese. Cottage cheese, that can be a sign of some yeast infection that needs some anti-yeast medication or antifungal medication to get treated. Okay, I think I've answered that question from Maurice. Then the other question is it normal for breasts not having the same size, like one bigger than the other? Yes, it is normal, but not that obvious. Like it's normal for one breast to be bigger than the other. Most ladies, they talk about, oh, my left breast is bigger than right, my right breast is bigger than the left, but not very obvious. Like you just see the breast and like, oh, this one is very extremely bigger. So if one breast is extremely bigger, like really bigger than the other, please I would advise you see a doctor. But it's a normal thing for one breast to be a little bit bigger than the other. Can a woman with 52% of low ovarian reserve still conceive? Yes, they can. As far as there's an egg. For me, as far as there's an ovulation, an egg is being released, there's a possibility of conception, though it might be reduced. Your advice for upcoming YouTuber. My advice for upcoming YouTuber is to start now. Avoid procrastination. You don't have to get like all the gadgets, you don't have to get all the equipment. Even till now, I don't have most gadgets, I don't have most equipment, I don't have what is needed, but just start. Like, begin today. Avoid that procrastination, I will do it tomorrow, or looking for excuses why you should not do it. Oh, I need a gadget, I need a phone, I need an iPhone, I need a camera, I need a stand. Make use of what you have. For those that have been watching me for more than a year now, we are going to 2 years now. For those that have been watching my video, you will agree with me that my videos at the very, very beginning were not clear. Like, you won't be able to see what I'm writing on the board. A lot of things were wrong with my videos. But as time goes on, I'm improving gradually and I'm getting better by the way. Don't listen to what people tell you. That's why you have something to offer to the public. You have some useful knowledge to give to the public. Start as soon as you can. Oh, Josie, we have a lot of questions to answer. Oh, I think we will do another live. Please, I want to ask a question. I have PCOS. I'm on metformin. How soon can one be pregnant with PCOS? I don't know if you've watched our video on ovarian cyst and also polycystic ovary syndrome. We have a video on that. I think that will explain the polycystic ovary syndrome better. How often, I can't really say how often you can get pregnant. You get, but what I will advise you at this particular moment is to speak with your doctor, is to meet with your doctor. Let your doctor know. Your doctor might give you some medications that will stimulate the ovaries to release more eggs so that fertilization can take place. You get, I am not with you, so my job online is just to give a general advice at this particular moment, because I'm not with you, I'm not doing any physical examination. So I will advise you see your doctor. Let your doctor know that you're about getting pregnant, if you want to get pregnant now, so that they help you out. They might give you some medications such as your human chorionic gonadotropins, your what they call this thing again, is off my memories. So they can give you those medications that can help stimulate your ovaries to release egg for fertilization to take place, and that can increase your chances of getting pregnant. And since you are on metformin, you can speak to your doctor about it too. Can someone have 38 days cycle? It's possible for someone to have 38 days cycle though, but the normal range is less than that 38 days cycle. Is it possible for her to conceive after that surgery? Hysterectomy? Is it hysterectomy you want to write, or hysteroscopy? Hysteroscopy is like viewing, it's not removing. It's when they remove it. Hysterectomy, they remove the womb. That's when a woman cannot get pregnant. But if they are seeing the womb, like they're checking, they want to know how the womb looks like, scopy, the woman can get pregnant. But if they are removing the womb, that is when the woman cannot get pregnant. I don't know if I'm answering these questions like you want them to. I'm just managing because I'm holding my baby and she's kind of disturbing. Just okay. I experience constipation nowadays, especially after taking beans. It wasn't like this in the past. I also experienced some kind of burning sensation in my stomach and extreme thirst in the morning. In terms of that, I could have said it's ulcer, because that may be a sign of ulcer. In all, see your doctor. Like I will always tell you, see your doctor. Then since beans is giving you discomfort, I would advise you stop taking it. Yes, anything that gives you discomfort, I see no reason why you should take it and start stressing yourself. Stop taking it, see your doctor. If it's an ulcer, your doctor will place you on some ulcer medication to help relieve those burning sensation and also pain you feel. Then in terms of constipation, try and increase your water intake and also fruits. Increase your fruits intake, increase your water intake. Take a lot of water to help soften the soup. Take a lot of fruit like your watermelon, your mangoes, and all that. I must stay in one place. Sorry, Sharon, I didn't get your question. You said, what causes veins in the legs and what can I use to heal the pain? Generally, veins are found all over the body. Veins are found all over the body. Veins are found all over the body. So I don't think your question is more precise in regards to that. But in terms of pain, normal painkillers such as your paracetamol, ibuprofen can be gotten over the counters. But if you know the veins, I don't understand. Veins are found all over the body though. But try and see your doctor if it's something I can't explain here. because I don't really understand the question you drop. I think that's Sharon. Can someone have 38 days cycle? Yes, it is. Yes, someone can have 38 days cycle. I had this white discharge some days before my period. Is it normal? The white discharge, is it looking like this? How should I describe it now? Is it slippery? Is white discharge slippery? Or it's just normal white discharge? Because generally, as a woman, discharges are normal. Your vagina is expected to bring out discharge. Yes, your vagina is expected to bring that discharge. But when the discharge have some characteristics that makes us think, oh, there's a need to see a doctor. But you can watch our videos on the various discharges in the vagina that explain the various discharges and what they mean. Josie, you don't want me to talk again? Where though the wizard said I skipped your second question. Can you drop it again? Please, is there any medication for normal ovulation every month? There is no medication per se, but there are some supplements that can help you regulate your cycle. There are some supplements you can take, some women supplements that helps you regulate your cycle and helps with hormone balance. You get? Oh, mama, you don't want me to talk. Somebody asked the question. Okay, I hope I'm not miss. Okay, I missed this question. What are the medications for high prolactin? Should I go ahead and say the medication? I think for medications for high prolactin, please and please see your doctor though. But the ones they normally use is carbagoline and carbagoline and bromocriptine. Carbagoline and bromocriptine. But in general, anything medications, I'm not doing online medications or online prescriptions. Please see your doctor. But medications that they normally use for high prolactin is a bromocriptine, gabagoline. But different brands have their brand identity and brand names. They might not call it gabagoline, but the constituent is like that. Please, is there any medication? I think I'm done with that. The questions are getting much. Ooh. Okay, yeah, favor. If the discharge is slippery, there's nothing for you to be worried about. That could be a sign of ovulation. If you've not watched our videos on the various signs of ovulation, you can check it. Signs of ovulation by Nurses Lecture Room. The video will pop up. Please, if you know I've not answered your question, please type it again. Oh. Like I earlier said, the live video was not planned, and also I'm my baby here with me. So I'm not fully concentrating on this life per se. Okay, Michael Favor say, right from time, I don't have a regular period, but sometimes I do, maybe for 3 months, and so is it normal? Sorry, my last month period was on the 15th of October, and my period for this month of November came on 12th. Is it normal? Wait, I don't understand. Right from time, I don't have a regular period, but sometimes I may. Wait, Favor, I believe you are trying to let me know that you don't normally have a regular period. You don't have a regular cycle. And your period normally comes after 3 months or so. Generally, people that don't have a regular cycle, and also they're having issues calculating their normal day cycle, most of them might be diagnosed of polycystic ovary syndrome. So what I would advise, if you are having an irregular cycle, you're not having a regular cycle, I would advise you see a doctor to confirm if there's a polycystic ovary syndrome or not. What causes stomach ulcer? In terms of ulcer generally, ulcer is caused by a bacteria known as Helicobacter pylori. That's what causes ulcer. So it's not necessarily starvation or hunger that causes ulcer, but starvation and hunger might aggravate ulcer. But ulcer is majorly caused by a bacteria known as Helicobacter pylori. Please, if you know I have answered your question, let me know that I've answered it though. I'm not wasting my time here. Please, if you know I've answered, I think you should give me a clue that, oh, Nurse Miss Mary has answered, so I know I'm not wasting my time. At least I'm attending to some people. Then the other question say, had ectopic pregnancy last year and I am diabetic. Now I'm 46, but with low ovarian reserve. Am I and I want a baby? Should I still have hope or just forget about it? Since it's low ovarian reserve, there are other methods of contraception you can try while still keeping your hopes high. There are other methods of contraception you can try. Yes, I think you should speak to a gynecologist close by in regards to that. IVF, IVF can work out. They can stimulate your ovaries to see how many eggs can be released. So things like that. Please and please, I'll just advise you speak with your gynecologist. I can't say, Mama, now. What? Joy Isaac, just let me know if you understand what I'm trying to say. Please see your doctor in regards to that. I can't say keep your hopes high right now. Sometimes I don't have a regular cycle, maybe for 3. Okay, wait, let me see. So I'm coming, Josie. Josie, no. Mama. Sometimes I do have regular cycle, maybe for 3 months also. Okay, Michael Favor. You can see my baby is crying. I'm coming. Let me try and see if I can sort out. Mama, here. Good girl. If you know I've answered your question, please let me know I have. Okay, at least I've answered Taravari, I've answered Joy. Please, like what supplements? There are different people selling supplements these days. I can't really say the names, but I will have to look for brands that I can recommend. I have to look for brands I can recommend. But I know there are a lot of women supplements that are online that is being sold that helps with regulation of hormones in the body. You get, so I can't really say the particular brands as at now, but I will try and research more, get good brand that actually does this supplement and let you all know. Because I'm not on any supplement, so that's why I'm not on any supplement, so I don't know which to recommend. Please, if you know I've not answered your question, type it again. I think I've answered as much question as I can. If you know I've not answered your question, kindly type it again. This is an unplanned life. Hopefully, we'll do a more better life and answer a lot of questions and be more specific. At least, baby will not be around to. Okay, Ura said I've not answered. Please answer. Can you type it again, please? Please, I didn't see your question. Just type it again so it pops up and I see it. Thank you. Type a question again. It pops up. What causes blood during sex? I think we have a video on that. Warola, we have a video on that explains the causes of blood during sex. We have a full video on that. Endometriosis can cause it. You get infection can even cause bleeding during sex. Even lack of how would I use this word now? When a woman is not wet enough, like that friction, when a woman is not wet enough, can cause bleeding during sex too. Yeah, that's what I want to use. Cancer, endometriosis, fibroid. All those things can cause blood during sex. But you can watch our video that explain more on the causes of blood during sex. At least I've listed some for you. Josie, you don't have to talk again. That's all. Did you get an answer to your question? Did you get an answer to your question? That's all. Did you hear me? I said dryness, friction, endometriosis, fibroid. They can cause blood bleeding during sex. How are you doing? Thank you, Danny. I'm fine. Any other question? That's all. You deleted your message. Jem, what's your question? Please type it again, Jem. Okay. Jem, can you type your question again? Hard flaccid. I've heard about it, but I've not really researched on it. Oza, I've heard about it, but I've not really researched on hard flaccid. But I know it's a chronic painful condition in men. It affects their penis. So that's what it is. But if you want me to make a video on hard flaccid, just let me know. I'll research more on it. Because I can't tell you I know a lot about hard flaccid. But if you want me to research more on it and get back to the house on hard flaccid, just let me know. I'll make a video for it. But I know it's a chronic condition that affects men. And the male reproductive organ. That's hard flaccid. Oh, Dana said, no, you covering their camera. Are you okay? Yes, I'm fine. The video was not planned. So my face, I was not ready for the video. And I'm with my baby. So that's why my face is not showing. Please pardon me. Hopefully when I'm doing a planned live, my face will show properly. Josie? Ma, sometimes I do have regular cycle for like 3 months or so. Or so, is it normal? And I saw my last month period on the 15th, then this month on the 12th. It's okay. Seeing your last period on the 15th and this month is 12th, that's a normal cycle. Let me calculate it. Just, I'm coming. Take here. I'm coming. Let me calculate. Let me just help you calculate your cycle and see. You saw it 15 last month. Yes. Okay, 12 this month. Let me see. Let's calculate 15 last month. That's October. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 23. That's 30. That's, you have like 29 days cycle. If I'm not mistaken, Michael Favor. Calculating from what you said, you could have 29 days cycle. Michael Favor. What makes a man... Okay, then Leonard asked the question, what makes a man's sperm to stop from the year 2008 no come more sperm? I go to different doctor, but nothing have been done. They did not find any problem. When you say sperm to come, I don't really get Fabian Leonard. I don't get Fabian. I don't mean sperm to come. Does it mean like the man is not ejaculating? Or the man is ejaculating but there is no sperm? Please, Nona, just try and make us understand what you're trying to say. I am still here. Maybe I'll be here in the next 20 to 30 minutes. 20 minutes, hopefully. So you can drop your question. Please, if you are here, just give a thumbs up to the video and drop a comment. If you know I've answered your question, let me know I've answered your question. Glad I've been able to answer your question, Michael. Yeah, I will. Mercy. I'll search for the supplement and look for a good brand to recommend. but I will need some time so that I don't come outside and say get this, and it's not ideal. So I will just search for the supplement and let you guys know. Just make sure you subscribe to the channel and you are notified. Any other question? Any other question? Opportunity to ask me question and you're not booking an appointment. For those that want to book an appointment, like you want me to call you, have a one-in-one conversation with me, especially those that I'm not clear with their question, just go to nurseslectureroom.com and book an appointment. When you book an appointment, I'll be able to get across to you at the appointed time. So for those that want to book an appointment, just go to nurseslectureroom.com. That's an easy site to access. Click on book an appointment and we'll be able to have a WhatsApp conversation. nurseslectureroom.com. Just book an appointment there and you will have. Please, you've not answered my question. Please, Jem, I didn't get it. I think I've answered your question and you are not online. For the last time, type it again. I'm looking at it. Jem, just type it again. I'm sorry, I didn't see that. I know you retyped it. Well, let me see. Let me go back and see. You're always saying the last message I saw is you've not answered my question, but there's no question. I'm not seeing your question. Please, Jem, just type it again. I'm here and I will see it. This one says, sorry, ma. Okay. Sorry, ma. If they say someone has high prolactin. Okay, I talked about that high prolactin. In terms of prolactin is a hormone in the body that is important for breast milk formation. So people with high prolactin, they tend to have breast milk. Most of them, they tend to have milk or discharges coming out from the breast because prolactin is a hormone that is necessary for production. So in terms of that prolactin, it simply means there's an hormonal imbalance. That person is having hormonal imbalance. So when they go to the doctor makes some prescription for them. I think I spoke about this prolactin. I told you about I talked about the medication that most people use to treat the high prolactin, which is a bromocriptine and carbagoline. But please see your doctor for better clarification and what type of treatment to use. It simply means there's an hormonal imbalance. You get when you talk about high prolactin level. Mama, stay one please now. Tell me, Anike, did you get what I'm trying to say? Please let me know in the comment section if you heard me. Bulk biostructure is a man. Who is this person? Mediskin Informasi. I don't understand what you wrote. Please pardon me. Michael Favor. Good night, man. And do have a wonderful sleep. Also take care of baby. Love you for always giving me the best so far. Thank you very much, Michael Favor. I really appreciate. Thank you. Mercy, my namesake. Glad I've been able to answer you. Daniel Champion, you good? Yes, I am good. Jem, I'm waiting for your questions. Please type. You said I've not answered, so I'm waiting for it. I've not seen the question, Jem. I think when I'm done answering your question, I'll go offline. Mary Johnson. Hi, Johnson. How are you doing? It's an unplanned life, so don't mind me. All you can see right now is to see my roof. My I didn't even on the light of my roof. So what you're even seeing is the torchlight from my phone. So I didn't on my light room. I'm not even doing anything. So it's just my phone lights that I on that even reflects in the ceiling. Oh, glad my videos helped you a lot, Samuel. Thank you very much. Glad it helped you. I wish I could help and answer as much questions as I can. Success Monday. In September, I saw my period on the 2nd. I think there's something wrong with that question. In September, I saw my period on the 2nd of August. Okay, wait. Okay, in September, I saw my period on the 2nd. In August, I did not see. But in October, I saw it on the 4th. In November, I saw it on the 7th. Please, why? You saw it in September, you saw it on the 2nd. August, you did not see. October, you saw on the 4th. November, you saw on the 7th. There are a lot of reasons why there could be alteration in your menstrual cycle. It could be during that period of September, October, those periods you missed your period. There could be stress level involved. Yeah, let me calculate the days before I tell you something else. In September, you saw the period on the 2nd. Let me calculate the days interval. That would determine. In September, you saw on the 2nd. Let me help you calculate and see if it's something you should be wearing. On the 2nd of September, yep, that's like 28. August, you did not see. Why didn't you see August? In July, can you remember the date you saw in July? Can you remember the date you saw in July? Because sometimes you could have a longer day or a long cycle or a short cycle that can make you not to see your period in a particular month. Yes, for those that have more than 30 days cycle, they might not see their period in a particular month. Then early the next month they see their period. So it depends on your cycle too. So what I want you to do is to calculate your menstrual cycle to know how many days intervals between the first menses and your other menses. So that will give you a clue if there's a problem or not. Because sometimes it's just the long cycle that makes you not to see a month. So once you understand your cycle, you know how many days intervals your cycle, that will give you a better understanding on how to sort out things and for you not to get worried. Oh, Joy, that's nice. Better is better. Very good. Book an appointment with your obstetrician and gynecologist. It's very good. It's better off. So there's Monday. That's what I've answered now. So there's Monday. I just answered your question. Did you live the life? I answered. I said that. Oh, I'm taking my saliva away. So there's Monday. I said that long cycle might be a reason why you didn't see it in August if you have a long cycle. So first thing you have to know is how many days cycle do you have? How many days cycle do you have? That will help you not to be worried or to be worried. So if you know how many days cycle you have, that will go a long way to help us with that question. What is black fascia? This person that's always asking me the question, like, I don't get, we are not done with your other question because I don't understand what you said earlier on. In terms of black fascia, I have no idea about that. Ulcers, I don't have idea about that. What causes? Sorry, just see. Jojo, how are you? You're asleep. What causes left chest pain and the person won't be able to do anything? Please, chest pain can be as a result of a lot of things. Heart disease, lung disease, a lot of things. Please, if you are having chest pain and it is stopping you from carrying out your normal activity, see a doctor. Please, you could be booked for a chest x-ray to know what is wrong. You could book for some particular test. See a doctor, please. Johnson. Mary Johnson. Princess, where is your question? Okay, I have a question on website for jobs here in Nigeria. I just wrote my middle. Websites for jobs are we use trackjobs.com, trackjobs.com. We also use Indeed, then NHS website, There's Indeed, there's NHS website, there's also Track Jobs. I think that's that. Oh, finally, Jem has asked, dropped her question again. Sex on ovulation day and days before ovulation pregnancy did not happen. What could be the cause? In terms of, okay, like, I get your question. I'm trying to reason out your question. Okay, now I get, Jem, your question. You're trying to find out that, okay, you had sex on your ovulation day, but yet there was no pregnancy. There's what we call unexplained infertility. I'm not saying it's infertility, but there's what we call unexplained infertility. That might be the cause. You can watch our video on unexplained infertility to talk about that. But the first question I want to ask you is, how long have you been trying to get pregnant? How long have you been trying to get pregnant? And also, when it comes to that, we have to analyze the mass sperm too. If the man has to go for semen analysis, you do analysis on the sperm to know, okay, if the man has a low sperm count or a high sperm count. Let's put it that way: low sperm count or a good sperm count. So you have to do sperm analysis on the man. If the woman is ovulating, she is sure that she's releasing egg monthly, and she has been trying for 12 months to conceive, but there's nothing wrong. I think it's advice. There's nothing showing up. I think you should advise the partner to do some semen analysis too, and the woman should also go for some examination. You get, it could be that you are releasing egg, but in terms of the semen analysis, the man is having low sperm count, the sperm is not enough to fertilize the egg, or the egg is being released, did not get, sorry, to its location. So things like that. So I advise you just see a doctor after 12 months, not now. You said you've been trying for 3 months. So 3 months is not something you should be worried about. For us to say that this person is infertile or this person is unable to give birth, this person has to be have tried. Oh, English is hard. This person must have tried for like 12 months, please. The person must have tried for 12 months for us to say that, okay, there's a problem with fertility or we have to be worried. But since it's just 3 months, I'll advise you to keep taking your time, having sex during your ovulation period, and don't give up. Jem, if I've answered your question, please let me know. I think I've answered your question. Mary Johnson, you can drop your question, definitely. I'll still be online in the next, okay, it's 47 minutes now. In the next 30 minutes. It's an unplanned live, but I'm glad I'm doing it. And I've been able to answer a lot of questions. Babies are awake and they allow me to sleep. So I decided to do the live. Okay. Fabian asked, what caused a man ejaculating but no sperm? No sperm in a condom after sex for a year. You know, when you ejaculate, generally as a man, when you ejaculate, it's not just sperm that makes up the ejaculate. That ejaculate is made up of like different fluid. We have fluid from the prostate gland, fluid from the seminal vesicles, and also fluid from from the testicles comes out. It's not just sperm that makes up that ejaculate. That thing that comes out of a man is just 10% sperm. That is why I want to be sure what you are talking about. There are different reasons why a man will not, like, there will be low sperm count. There's what we call, I don't know if it's azoospermia you are trying to ask about. There are different reasons. For us to know the solution to the problem, we have to know what is causing it. A lot of examination has to be done. Your doctors have to do some scan, some blood tests, and all this for us to find out, okay, what is really causing this azoospermia? Why is there no sperm in your ejaculates? Leonard, I don't know if I'm making sense. Mommy is live. Mommy is doing live video. Leonard, I don't know if I'm making sense. Just let me know. Did you get my explanation? Yeah, okay. So since Monday, it's possible because you saw it July ending. That's why you didn't see it in August. It's possible you saw it July ending. That's why you didn't see it August. And your cycle is long. It's not short. You have more than 30 days cycle. So if you have more than 30 days cycle, that might make you not to see it in a month. Josie, Jojo, Jojo, mommy is live. Oh, see, it seems like I earlier said, I don't want them to ban my child, so I don't do online prescription. So I advise you see a doctor. In terms of drugs to gain weight, there are some drugs that you take that stimulate your. It's not really drugs; they are supplements you take, such as your they call this thing amphetamines. I think amphetamine. It increases your appetite, so it makes you eat more. Definitely, as you are eating more, definitely you add up weight. So that is that for that person that asks. I think Mary Johnson, how to gain weight. So when you eat more, definitely you are going to gain more weight. So amphetamine is a supplement blend that helps you with that. You said drug for pimples. I'm having a lot of acne. Me myself, personally, I'm battling with acne. I've tried a lot of things, but still not working out for me. So I am not in a better position to give some prescriptions for acne, that's pimples, like you call it. So I'm not in a better position to give an advice in regards. I think a skin expert, somebody that's a skin expert that deals with skin, will be in a better position to do that. Johnson. I'm still live. Any other question? Is it vitamin D? I mean, I'm vitamin. Let me see if I can type. I'm coming. Let me type. Wait, I don't know how to type on this question. Amphetamine is spelled AM. If you can hear me, AMPHETAMINE. It's not vitamin D. It's made up of different supplements. So it's not vitamin D per se. It's different supplement that makes up the amphetamine. It increases your appetite, so you can eat more. Oza, I'm not getting your questions you keep asking. I think it's Oza that's there. I'm not getting the questions you keep asking. Wow, I've answered a lot of questions today. I never believed I would be doing this. Seriously. I never believed. Josie, we never believe we would be able to answer some questions. Generally, in terms of health wise, I think I should put this out. When you notice something different from normal, from something different from what you normally see in your body, don't just keep it to yourself. Research about it. Also see your doctor immediately. Like for those that have been watching my video, I will always advise it is better for you to see a doctor and the doctor tells you, oh, I've checked, there is nothing wrong, than for you to assume nothing is wrong and something is wrong. So if you have the finance, you can take care of yourself. Whenever you notice something is not normal in your body, ask questions, see a doctor. Especially if it's regarding to your women's health. Don't just see any doctor. See an O&G doctor, the obstetrics and gynecologist. See them. Those are the doctors that are in better position to tell you what is wrong. Not just anyhow doctor. Because we have eye doctor, we have teeth doctor. So we have skin doctor, we have different doctors. So if you're having issues in regards to your reproductive system, it is better to see an O&G doctor, obstetric and gynecologist. Vitamin D tablets. What? Yeah, vitamin D tablets is an essential vitamin. You can take vitamin D tablets. Daniel Champion. What do you want me to talk about vitamin D? Do you want me to explain it? What do you want me to say about vitamin D tablets? Jojo, we live. or will be going out soon. It's an unplanned live, and I was not expecting to see people. I was surprised when I just went live and I saw 30 something people. Wow, that's really good. Now we are 27. Mama, say hi. Any other question? I think it's almost 1 hour. I've tried. I I tried answering as much as I can. Any other question before I leave? I'll be leaving in the next 5 minutes. Yeah, I just wanted to get to 1 hour. It's 55 minutes we've been online. So I'll be leaving in the next 5 minutes. If there's any question, please drop in the comment section, in the live chat. If there is any question, just tell them to drop in the live chat. If there is any question, drop in the live chat. To book an appointment, just go to nurseslectureroom.com. Josie. Oh, my battery is low. I didn't even notice it. Oh, my battery is low. I didn't even notice. Oh. I'll be leaving in the next 4 minutes if there's any question. Thank you, but doctors make a lot of tests already. Can't have anything where I can talk to you. Like I just said, to get across to me privately, go to nurseslectureroom.com. nurseslectureroom.com and book an appointment. You'll be able to have access to me and I'll be able to place a call across to you. I think there's no more question. Josie, we have to say bye. Let's tell them bye. Any other question? We here. Hopefully, my next live, you're going to be seeing my face. But today was not planned. It was really surprising that I got a lot of people coming online, like 40 something, 50. Like, it wasn't even announced. I'm glad I have a family. I'm glad I've been able to answer some questions. That's a good one. I'm super excited that I was able to answer a lot. If you have any video you want me to make, if you have any topic you want me to make a video on, just drop it before we go off. If you have any video you want us to talk about, you have a question you want us to make a video on, just drop it. I'll be going off in the next 2 minutes. Interesting. You just did that on my body. I'll be going off in less than a minute time. How to lose weight. All right, I'll try and make a video on that, because I personally, after delivery, I had to I had to burn all the fats that I gained during delivery as soon as I can. Now I think I've got a lot of message. Now my flat tummy is back. Everything is back in shape. Like I've not given birth. So I think I'll make a video on that. At least I have an idea about that. And I can research more and add to it. So I'll try and make a video on that. All right, we're going out in the next 10 seconds. The video will be ending. 10 seconds. Any other thing? Any other thing? Any other thing? Just say that bye. Just say bye. Thank you all. Thank you very much for coming live with me. Thank you for staying live with me. We are ending it now. We are wrapping it up. It was nice. It was really, really nice talking to everybody today. Bye. Say bye. Just say bye. Say bye. You're crying. Say bye. Say bye. Bye.